I'm here with Dr. Livingston, and we are talking about depressions and forms of treatment. So one of the things that the doctor has brought up that is very interesting, and I find it absolutely fascinating, is hormones and how they pertain to depression. So a lot of people don't know that hormone imbalances can cause mood swings. It can cause abnormal feelings that one may not otherwise feel. And Dr. Livingston is here to discuss with us some of those side effects of hormone imbalances and some treatment options that he may have available to help. Thank you for having me.
Thanks for having me.
Yeah.
So one of the things that is really evaluated, undertreated, are hormone deficiencies. Imbalances, a lot of people will say, menopause is the most common that people see and know about, right? Mm-hmm. We know that the hormones all stop then. That's very simple. Everyone's aware of that. But what most people don't know, including many physicians, is that testosterone plays an important part in health and wellness in both men and women. Mm-hmm. Typically, we think of testosterone as a predominantly male hormone, which it is. That's what makes men more masculine, because our levels are much higher. However, women do and often have levels of testosterone in their early teens, 20s, and often by the time they're in their mid-30s, it can be very low or even absent. And diminished or gone testosterone for women can result in significant problems, including decreased libido, decreased energy, focus, motivation, increased body fat, decreased muscle mass. Basically, all of the things you don't want as you age can be related to low testosterone. And unfortunately, physicians and patients alike feel like hormone replacement is just not accessible for women, that there's no such thing, because a big study came out in the early 2000s called the Women's Health Initiative Study, and it was studying estrogen and progestin, nothing to do with testosterone. And it came out that hormones were bad for women. Therefore, many doctors and patients just don't even seek treatment. And it's very, very disappointing, because it's very easy to manage and treat. Symptom improvement in women and men both can be very dramatic. It's something that really, really needs to be addressed more. We're seeing a lot of low T centers, Center for Men, all focused on men. You call those places a female, they tell you they can't help you. Mm-hmm. You reach out to your primary, your OB, GYN, same thing. Or they put you on oral estrogens or some other ineffective medicine that comes with its own risks, its own side effects, and actually its own negative effect for the symptoms you wanted, right? You go in wanting energy and fat loss, you put you on estrogen, you're going to be moody and fatter. That's not much good. So we want to look at the other alternatives, that being testosterone replacement.
Do you feel like, and you guys, I know especially as our women viewers tune in, a lot of times we don't think about, I know I'm that way, I always think, oh, well, I'm not in menopause yet, so why are my hormones so important?
Absolutely.
Unless you've gotten some new form of birth control or something where you know it's absolutely wrong, and you put on weight, or you have these mood swings, which we as women obviously do as ladies. And so one of the things that you've brought up to me is, especially for women and their health and women's health and well-being, is to really tune in and get those hormone levels checked regularly, even to see if they have them present or not. I know that we've had some people that you've mentioned that they were on birth control and maybe they took a testosterone test and they had nothing, and yet they're put on weight and they don't feel good and they have a low, like you said, a low drive, they don't have a lot of energy. And these are things that testosterone can help, but as women, we're not told to, or we have a preconceived notion that somehow we're going to end up growing a beard. So,
and of course that is always
I don't want a beard.
Right, and of course that's always a concern, correct? So that, again, is why I said it's thought of as a predominantly male hormone. It is.
Yes.
And given male doses, those things would happen, and I do treat that. I do have some patients that are going through, basically transgender. They're going from female to male. That is kind of completely different treatment than what we're talking about for females. The reason why I mention it as a symptom or treatment for depression is that all of those things we mentioned are symptoms of depression. And that's where doctors unfortunately miss the boat, right? So if you just ask the patient, how are you feeling? Oh, I'm down, I can't do anything, I'm eating too much, I'm sleeping too much. Well, here's an antidepressant. Often the symptoms get worse.
Yes.
You gain more weight, you get more tired, you get more moody, you get bad guts, all sorts of things go along with antidepressants. When what they needed to do was check your thyroid and your testosterone. Because 10 to 15 years prior to menopause is the most common time where women go through the medical term of andropause, or loss of testosterone. And that's something that if you don't treat it, it's not going to get any better.
Mm-hmm.
And if you have the wrong diagnosis, it doesn't matter how good the treatment is, it's never going to work. And so if your treatment is, or your diagnosis is depression, give an antidepressant, but it wasn't depression, it was hormone deficiency, it can't work.
And I think a lot of times for women too, if they can get too much into their emotions, we create these stories. And what we do with these stories, guys, is we believe that what we're saying about our bad feelings is truth. And it's not. It's a delusion from the hormones actually blocking your ability to think clearly. So Dr. Livingston, talk about how too much estrogen can cause brain fog.
Well, what we see very commonly is again, here's your imbalance, right? We need a balance between testosterone and estrogen, men and women both. It is a completely different balance, of course, right?
Mm-hmm.
In men, we want about 3 to 5% of our total testosterone as estrogen. But in women, you're going to be probably around a 1-to-1 ratio, completely different. Levels much different, idea very different. Effects, though, very similar. More motivation, higher sex drive, more muscle mass, less body fat, more energy, better sleep, less pain. I mean, all of the things that you can think of that would be not depression come from replacing testosterone when it's deficient. And we're not talking about giving somebody so much that they're going to be in the bodybuilding contest or growing beards
I don't want a beard.
or changing their female parts to male parts. None of those things, right? These are much, much lower levels, about 1/10 of the dose for a man.
Sure.
So it is something that is very safe, it's effective, it's bioidentical, meaning it's the same thing your body did make. It's also vegan friendly, it comes from plant sources, it's not synthetic.
You guys, it's way healthier than even some of the topical creams that I've heard of from the OBs. It's all natural. It actually comes from yam, is what the doctor was telling me.